great number of people required to produce cotton in years past are now obsolete as far as this economy is concerned. And while the plantation manager or owner had a vested interest in the survival of the people he needed to grow his crop, this is no longer true.
In many cases, our people are simply squatting on the land. So naturally, you know, if a white plantation owner doesn't need him for his economical gain, he's not going to spend any money on the house he's living in. This is plain facts. Living conditions are such that people will leave.
I hate to think about the life of today. It's almost as poverty, as much as in poverty as yesterday. Out trying to find a place to go. A lot of people have been left on farm with just living in farmhouses without any protection against anything come up.
You find a median age of 15. The average age of male heads of household, 57, indicative of the fact that people in the most dynamic phase of life elect or are forced to go elsewhere to survive. This country has an obligation to do something for people who have donated 300 years of free labor to the American economy.
What kind of a place are we? I think we're a place that has as its primary thesis that the determinants of health are in the social order, not in health care. I've never seen any use in what I call the Schweitzer bit, which is the idea that you stand around in whatever circumstances, laying hands on people in the traditional medical way, waiting until they're sick, curing them, and then sending them back unchanged and into an environment that overwhelmingly determines that they're going to get sick. We think there's a better way to do it by using health services as a route of entry for these other kinds of social change. We're trying to do that here in, 500 square miles, 14,000 black people, with a median annual family income of $900 a year, with an average of 4 years of schooling in Mississippi schools, which very often means functional illiteracy, with an infant mortality rate of something like 70 per thousand. And so sure, we have the physician, nurse, lab, pharmacy kinds of action, all of the usual pieces of medical care. But much more than that. We take health care into the home. We do a lot of other things in the home.
Approximately, 3.5 years ago, when I first met Dr. Jack Geiger, he told me about his aspirations of going into Mississippi, into an indigent population, and setting up a community health center, comprehensive community health center. At the time, I thought this was really an idiotic idea, since I had already practiced in Mississippi. But in December of 1968, I came to Mississippi and joined Dr. Geiger and his crew of doctors. And after 8.5 months, I can see that these centers are going to be the answer. And the doctors are going to have to get out of their private offices. Medicine may be the way that we got in the door, but, medicine is not #1 priority. There are other priorities, and those priorities are food, #1. And then the way to make a living, so as to make a man, want to stand up and support his family rather than to go somewhere and sit down in the sun.
I don't know if some of the Mississippi white power structure cares about dead black babies or not. But if they don't, even they can't afford to say so publicly. We have been able to enter and to do things under the general umbrella of health that would have been much harder to do if we'd said we were here for economic development or for social change per se.
She's 6 years old, and she was referred to nursing services from social services with a diagnosis of encephalitis. This little child had been sleeping with 4 of our other sisters and brothers. We had to provide a bed because, first of all, you have 12 people living in a 3-room house, 2 bedrooms and a kitchen. Of course, everything is in poor condition. Because of the family's income, they don't even have enough food to go around. I showed the mother how to tube feed her, how to give her range motion exercises. The mother really, she's more concerned about the child than most mothers, I would say. She wanted to keep her child at home.
Bridget. Bridget. Your name is Bridget. Yes, sir. What's your name? Bridget. Name Bridget. Okay, now, can you count for me? Yeah. Okay, count for me. 1, 2.
Our concept of health is to make social change, to build the institutions that can make social change and keep it going. We call it community health action.
What we have developed is a health association with a very high degree of local autonomy. The Health Council has emerged as a poor people's organization that is not only concerned with health as narrowly defined, but rather sees itself as having a vital interest in the overall development of the community.
I thank you all for coming out tonight, and I'm always proud to come to the Health Association. And I'm hoping that you all will encourage other members of this association to come and be with us. Explain to them what we are trying to do. My determination is to go forward. I don't mean to look back.
These health associations, they have a contact center where the patient come and wait for the drivers to pick them up. Before it was a contact center, why? It was full communication. They have people to go out there and organize the communities and bring the people together and find out the problems they have in the community.
Probably our biggest single and most important component is environmental change. How do people live? And so we dig wells, and we build privies, and we provide safe water supplies, working together with the people who need them.
We're doing a great deal of basic sanitation here, and this we can't get sophisticated at all. And I would say it's probably similar to some undeveloped countries. We try to treat the environment as a physician is treating the individual. We can really begin to practice preventive medicine. It was necessary for us to train the people we need from our resident population. Obviously, we can't bring in enough people who would stay. And so we have to train the people and use the people that are here. Get right, church, and let's go home. Get right, church. Well, get right, church. Get right, church, and let's go home. About 50% of the people that live in the area have no on-site water. They usually have to truck water in, or they may carry it 4 to 5 miles round trip. If there's sickness in the home, it makes the loss of water much more critical. We might halt that family water to cope with the medical crisis. We may drive a pump, but that still isn't going to be the final answer. I would say about 65 to 70% of the housing in the whole entire area for black folk would simply be unfit for human habitation. The women in the area were hardest hit because the men will tend to leave. If a woman is about to deliver, we'll go out and we'll install steps, or we may provide the screens for where the young babies are.
What you really need to do is give him a bath. That skin, you see, comes right off. All you have to do is roll it. Yeah. It comes off, and he'll be cooler when you get that off of him. And just soap and water will get it right off. Yeah. Okay. When you get bathing him, get in between his fingers, you know, that's where all the lint is collecting. Yeah. He has little balls of it in his hands, in between his fingers. I never thought before of the importance of having an entire program under one roof, if you will. How important it is to the people themselves, not to me, but to the people. You know, they not only are pregnant and going to have a baby in the family, they're starving, and they have very little to eat, they have nothing to wear. And so if you can't take care of those things, then the baby's not that important. They'll take care of that themselves. They've been doing it for years, you know. And it's our other facilities that has helped our mortality rate, because even though we get them and we have good doctors and they get good care, they also get well in their yard that has good water in it, and they get screens on their doors, and something's done about the flies and the rats and the roaches, all of the kind of things that makes them unhealthy to begin with.
We found that the services we had to offer were not really aimed toward the most basic needs of the population, which was food, clothing, and shelter. And people began to ask us if we couldn't help them to get food. And did the people in Washington really understand that they didn't have anything to eat? People were asking for jobs first. And if they had jobs, they could get food. They were not really asking for relief, but rather an opportunity to earn it if at all possible.
We took a look and we saw an agricultural people displaced by mechanization, sitting on the richest land in the United States, hungry and with nothing to do. And it looked to be a better way to put that together. And what emerged from that and the 10 health associations was the North Bolivar County Farm Co-op, I think the first co-op in the United States of landless people, in which something like 1,000 families pool their labor and run a 500-acre irrigated triple crop farm, growing the vegetables, not cotton, that they need to eat. And they are getting very close now to building a cannery to produce food not only for their own needs, but to export. In short, to have an agricultural industry that provides jobs, income, technical skills, and the possibility of a reasonable life in this country.
And one thing that we should keep in mind, foremost in our mind, is the fact that this is not a corporation, you know, where the decisions are made by just one people or 2 or 3 people on top, and then everybody else sort of falls in line. But in a cooperative, the decisions are made by all of the folks on the bottom, and then the people in top fall in line. You know, that's how I go. The people out here in these little communities out here really make the ultimate decision in their community meeting. And they tell that man that they sent to the board of directors what they want done. And he's supposed to implement that kind of thing. So you really got all of the masses making decisions there. You know, I know the whole concept of management to black folk is a brand new bag. Because all our lives, we've been in the workers only category. You know, you've seen folks up there, you probably got relatives like I have up in Detroit and Chicago and been working for a plant for 40 years, and he hadn't moved any further down the assembly line than he was when he started. He might have started being a fitting man, and he might have the pride of the people in being a part of the cooperative, a part of something that's all black and for black and black run is tremendous. The unique part of the co-op was that it's a federal program that puts emphasis on people, developing people. A better way to put it maybe is to say that we give people jobs where they just have to use the skills they've already learned. For instance, there's not that much difference between picking cotton and picking lima beans. I see a whole new thing with people being able to take their high school graduation diplomas and stay here. And I see a lot of potential for people. I see a lot of opportunity for people to do the same thing they've been going to Chicago and New York and places to do. And that is, trying to find jobs so they can buy a house and buy a car and buy fine clothes and everything. I think they're going to be right here.
And as farm manager of the North Bolivar County Farm Cooperative, I've enjoyed working with people, and people have enjoyed working with me. And then we got people who were born and raised here in this county, and they're in the North, and they want to come back. Some of them have been writing asking me if I could assure them a job. Well, they're ready to come back now. In the cooperative, they're working together, and they've got their minds together, and they're getting their hearts together. And this is something we wish the entire world would do.
It is this kind of new social institution that needs to be created if social change is going to be made. And that is a lot more important than giving penicillin shots or treating pneumonia or doing any of the other let's bail it out after the disaster has occurred kinds of things that medicine has been focusing on for the last 50 years. New social institutions means people developing and managing their own new programs to meet their own needs. If people from 500 square miles are going to get medical care or have economic mobility for jobs, then they're going to need public transportation. And so the Health Council now manages and operates an entire bus transportation system for patient transportation and economic mobility that operates throughout all of northern Bolivar County. New social programs mean supplemental food, a program operated by the Health Council. That means managed and operated by poor people themselves to provide better nutrition for mothers and children. And then together with the health center and the farm co-op, it means nutrition demonstrations in the home and in the community so that people can make the best use of new foods, either from the farm co-op harvest or from the supplemental food program itself. There's no point in food if people don't know how to use it. When the farm co-op grows a new kind of high-protein corn, for example, it's the nutrition program that shows people how to make it into hominy. The Health Council also operates a legal and government agency assistance program, helping people to solve their own problems, to protect themselves from systematic exploitation on the base of race or poverty, and giving the poor, the black man, and the rural resident access to state and federal programs that are supposed to be for everyone, but which have never before effectively reached them. There is no health without a healthy place to live. And so one goal for these new social institutions is the development of cooperatively owned, rural, low-cost housing. The Health Center, the Health Council, and the Farm Co-op are working together on the blueprints for a decent, basic house that can be built for only $3,000, opening the possibility of home ownership to the thousands of displaced rural blacks and whites now virtually adrift on the land. Community organizer John Hatch, Director of Community Health Action for the Health Center, sees the development of a low-cost house as an essential step in providing a viable rural alternative to migration from Mississippi to the urban ghetto. Most of all, new social institutions means investing in people themselves, developing the enormous human potential in Black America that is now so often wasted by deprivation. It starts with children, so the Health Council is now launched on a preschool, pre-Head Start program of early childhood intervention in 10 Bolivar County communities. We plan to stop deprivation before it starts, instead of trying to play catch-up later on. It goes on with youth work and career guidance for teenagers, with men like sanitarian Andrew James, the Health Center Director, as both professional model and teacher. It includes in-service training for Health Center staff, and almost all of the staff of the Tufts-Delta Health Center are local Bolivar County residents, people who once were trapped in plantation shacks, now working proudly as nurse aides, as obstetrical and surgical physician's assistants, and in other technical jobs. Through training at the Health Center, they increase their skills, learn new skills, and begin to move up the economic and professional ladder. Most important of all, it includes college and professional training, a college preparatory program at the Health Center with people like Dr. David Weeks, the clinical director, doubling as teachers. As a direct result of the Health Center program, there are now 7 black men and women from our area in medical school, 3 in nursing school, several in social work school, 3 in environmental engineering college, and more than 20 in college. We expect them back to replace us. Finally, this thrust toward a new future involves pride in the past, a sense of one's place in history and in the struggles of the present. For this, the Farm Co-op operates the North Bolivar County Afro-American Bookstore and Cultural Center, a place for the healthy growth of the mind and the spirit. Through these books, the whole world is available to people out in the rural. We believe these, too, belong in a program for health, social change, and an end to poverty. Our goal is to make change in the social order, which will see to it that people stay healthy, rather than merely to clean up the human debris of the kinds of social disasters that have gone on down here. So our task has been to organize people, to help them organize themselves, to encourage them to articulate their own needs, and then to give them the technical assistance to act to meet those needs. That's what a community health program is, and that's what we've been trying to do.